There is a general misconception that lifting weight or resistance training is only for bodybuilders, powerlifter or sports that uses strength. Instead, there are many health benefits to lifting weight. Let us understand the benefit of resistance training or weight training to increase the overall health of an individual. Hi, my name is Galsin Chiring and welcome back to my channel. Loss of muscle mass due to aging is known as sarcopenia. Resistance training not just help us to build muscle mass, but also help us to regain the lost muscle mass which was caused due to sarcopenia. Let us understand this from a review paper which says that there will be 3% to 8% muscle loss each decade after the age of 30 and 5% to 10% each decade after the age of 50. It also says that regular resistance training can increase muscle mass in adults of all age. And a study with more than 1600 participants between the age of 21 and 80 years increases mean lean weight of 1.4 kg after the 10 week of resistance training. Resistance training or weight training help us to increase our resting metabolic rate. Resting metabolic rate is the energy used by our body to perform basic function when our body is at rest. There are two ways in which resistance training increases our metabolic rate. Resistance training increases the muscle mass due to which more energy is required for ongoing tissue maintenance. Resistance training also causes tissue microtrauma, which is known as muscle damage, which requires large amount of energy for muscle repairment process that may persist for 72 hours after the training session. Excess body fat has serious health consequences and also increases the risk of certain diseases like heart disease, high blood pressure, certain cancers, and many more. Research have shown reduction in approximately 1.8 kg of fat weight. Research also revealed significant reduction in intra-abdominal fat resulting from resistance training in older men and women, and only 1/3 visceral fat or intra-abdominal fat gain in premenopausal women. It also claims that increased resting metabolic rate, which seems to be a major factor in fat loss, which is true in my point of view, as increased metabolic rate requires more energy. As people age, there will be a decline in insulin sensitivity, and resistance training is an effective approach to counteract the decline in insulin sensitivity and prevent the onset of type 2 diabetes. Resistance training reduces intra-abdominal fats and decreases blood sugar level in people with abnormal glucose metabolism. Resistance training improves glucose and insulin homeostasis because of increased muscle cross-section area and lean body mass, as well as improvement in muscle metabolic property, which means that resistance training improves the balance of insulin and glucose to maintain healthy blood sugar level. It is also suggested that resistance training incorporating higher volume and higher intensity may be more effective than lower volume or lower intensity for improving insulin resistance and glucose tolerance. Cardiovascular disease is a major health concern right now, and it is the leading cause of death right now in the world. Cardio means heart and vascular means network of blood vessels. Factors which affect the cardiovascular disease are high blood pressure, diabetes, blood cholesterol, lifestyle and food. There are several studies which demonstrate reduction in resting blood pressure due to resistance training. Resistance training may increase HDL or good cholesterol by 8% to 21% and decreases LDL or bad cholesterol by 13% to 20% and also reduces triglyceride by 11% to 18%. Research reveals that muscle loss is associated with bone loss due to low bone mineral density. Low bone mineral density makes our bone weak and brittle, due to which fall or small or mild stress can make our bone fracture. Bone mineral density is the amount of mineral present in bone tissue. And research claims that adult who doesn't perform resistance training may experience 1% to 3% reduction in bone mineral density every year of life. Research also says that resistance training is beneficial to immature skeleton in several ways. Soccer player who had 4 or more hours of resistance training per week showed significantly greater gains in bone content compared to player who had only 2 hours of resistance training per week. Resistance training or strength training has shown equal benefit to mental health as well. Numerous research has shown the benefit of strength training or resistance training in improvement of anxiety, cognition, depression and fatigue. It is also shown to improve the chronic pain and improve the quality of sleep by 30% and more. This is due to the release of hormones like endorphin, dopamine, serotonin, etc., which increases feeling of pleasure, well-being and reduces pain and discomfort. So we are done here. Let me know what you think about the video in the comment section. If you like the video, do hit the like button and subscribe for more updates.